Nearly half of Minnesota hospitals outside the Twin Cities lost money last year. It's a serious threat not just to healthcare, but to communities as a whole. Ayla Ellison is editor-in-chief at Fierce Healthcare, and she has a cautionary tale from her own hometown in Illinois. This is Hospital Matters, a podcast from the Minnesota Hospital Association. We're having conversations about issues impacting hospitals, health systems, and patient care in Minnesota. I'm Tim Nelson. In this episode, we'll talk with Ayla Ellison, editor-in-chief at Fierce Healthcare, a well-known online news outlet that covers the U.S. health industry. She recently published a lengthy look at her hometown, Carmi, Illinois, where the White County Medical Center closed 20 years ago. She offered her hometown story as an example, showing what's really at risk when a community closes its hospital, and it isn't just healthcare. We'll start, though, with some thoughts from Dr. David Herman, the CEO at Duluth-based Essentia Health, one of the largest providers of health services across northern Minnesota. He's the past chair of the Minnesota Hospital Association Board of Directors and says these risks are real for healthcare in Minnesota.
Communities are important to health. They support us, our children, local commerce, and many of the things that sustain us and our well-being on a daily basis. For those of us who are children of the 70s, we can recall the words of Joni Mitchell when she sang, "You don't know what you've got till it's gone." It's a normal aspect of the human condition to take things for granted, or understand that the impact of a loss reaches far beyond the loss itself. The presence of a hospital in a rural community is first and foremost recognized as a site where healthcare is delivered. For communities that have lost their hospital due to the closure of the hospital, or who have experienced significant decreases in the scope and scale of the services in their local hospital, the recognition dawns that the community hospital was something much more than a place to get medical care. It was the primary gateway to the broader healthcare system outside of the community. It was often the largest and highest paying employer in the community and the surrounding area. It was the magnet that attracted and retained employers in the area. It was the center of the community that kept schools, churches, grocery stores, and other community benefits close by. And when the hospital closed, these other aspects of a thriving community were threatened and often lost. Ayla Ellison joins our MHA colleagues to tell the story of the closure of a rural hospital in her hometown of Carmi, Illinois. She will share the journey of Carmi since the closure of White County Medical Center and the broad adverse impact of the closure of the hospital and the shadows left on that community from that loss. I hope you will listen to her story and recognize your community and the impact of your local hospital in your community. Action came too late for White County Medical Center in Carmi, Illinois. Let's listen to their experience and learn their lessons and work together to preserve and sustain the hospitals in our rural communities. And let's commit to actions that sustain our rural hospitals, to keep healthcare close to home and to keep our communities vibrant and vital for now and for future generations. We should all be able to live our best and healthiest lives where we choose to live our lives. Our rural hospitals are critical to fulfill that aspiration.
And I started our conversation with Ayla by asking her about her home.
So a little bit about Carmi. It is in the southeast corner of Illinois, a very far southern corner. There's maybe 5,000 people there. It's the county seat of White County. And White County is shrinking. It's aging. About 1 in 6 people who live there are below the poverty line. There's a really high level of Medicaid coverage there. A significant portion of people are covered by Medicaid. And then there's also about 10% of adults there under 65 don't have health insurance at all. So talking about a lot of the health related things, given the topic of our discussion. But I think that, those are kind of just some statistics that I rattled off. But I think the thing that gets lost when we talk about places like Carmi is that those really aren't just statistics. They are conditions that determine where people can stay, if they can stay in place. if they grew up there and if they can safely grow old there, whether people can raise children there. So some of those metrics that I shared are pretty steady, but beneath them is a much deeper question about what kinds of communities can really continue to sustain themselves in rural America today.
And this is an old river town that's sustained itself for a long time. It's been an oil town and a coal town. I think there was a Air Force radar base outside of town for a while there. So it has had a thriving economy for a long time in the past.
It has. It was, like you mentioned, it's a river town. It was a somewhat central location for several local and regional train routes. It did, of course, it was a large and thriving, or it had a large and thriving oil industry at one point. Same with coal industry, which are both, no longer the coal mine there has closed, and the oil industry, of course, in that area is not what it once was. So what was once a very thriving economic area really it is no longer.
Now, this town is also inspiration for a great article you did for Fierce Healthcare in November about what happens when a town loses its hospital. You've covered rural healthcare, you've covered hospital closures professionally, and clearly found some inspiration there in Carmi. Tell me about what drew you back there. What gave you the idea to use your hometown as an example? I think you said the White County Medical Center had closed in 2005 when, I don't want to date you here, but when you were in high school?
Yes, that is accurate. So, as I have been, reporting on, writing about rural hospital closures for many years now, and I think, growing up in a place that lost its hospital, of course, I think that's what kind of drew me to this topic in the first place, is trying to tell the stories and draw attention to some of these issues that we're not getting the kind of coverage that other topics were. And so I think that if a rural hospital is in dire financial situation or is on the verge of closing, or even if it closes, that doesn't make national headlines, of course. And so as part of my reporting over the years, one of the things that I was trying to do through that was tell the stories of the people, the administrators, the local residents, and how a hospital closure would impact them. And over the years, I'd written, stories about a lot of different hospital closures, and for me, this one was kind of coming full circle, not only bringing to light and amplifying some of these trends that we're seeing in rural America, but also a chance to draw more attention to the very specific example of my hometown and my experience with how that impacted my community, the people that I grew up with, my family and friends. And so whenever any hospital closes in any part of the country, it's a loss. And in rural America, that's the same. As I wrote in my story, the research on this is really actually quite stark.
I'd like to sort of break that up into three categories here. Talk first about the health impacts,
Sure.
which you've done a lot of research on, but you've also done a lot of research on economic impacts, that this isn't just a healthcare matter. And then, as you said, you know the people that were here when this happened and have seen what their responses were. So I'd like to sort of go through those. So your article has some really excellent research on health impacts. You start out in your article talking about two kinds of America, or two Americas, one that's a few minutes from a hospital and one that's more than an hour from a hospital. Tell me a little bit about what those health impacts are when a hospital closes and suddenly emergency care or acute care or inpatient care is farther away.
Yeah, and even just to talk about rural America, just the baseline for things, we know, and it's important to understand that rural Americans already carry a heavier burden of chronic disease. So in rural America, we know that there are higher rates of obesity, of heart disease, of diabetes. So when a hospital closes and you're removing that local hospital, it's not just an inconvenience. You're really compounding existing health vulnerabilities with new barriers to access. So for the health issues, obviously emergency care, that's a huge concern. And many of these counties and towns across the country that have lost full service rural hospitals have tried to, and some successfully, stand up essentially freestanding emergency departments to help sort of triage those patients that need immediate care. And that is obviously much better than not having any services at all locally, especially in those emergency situations. But for communities that haven't been able to establish a standalone emergency hospital or emergency room, then you're looking these travel times across the country. They vary depending, of course, by state and region, but some of these areas of rural America that have lost their hospitals, now these patients are traveling across state lines or more than an hour just to get emergency care. And then the other fact, or the other part of it too, is just for things that are more routine, such as childbirth. These people are. It was just looking across the country. One of the people that I spoke with for my article was the leader of the Oklahoma Hospital Association, and he was telling me about how in different regions of Oklahoma, of course, there are no hospitals that are delivering babies. So in this area, in one area, people are going to Texas, and in one area, they're going to another state. And so I think that what he shared with me in my reporting for this story really, it really touched me because, like where I grew up in Carmi, after the hospital closed, whether it was a childbirth, you sprained your ankle and needed to get that checked out, any other type of care. I mean, you're traveling to Evansville, Indiana, and that was a 50-minute or more drive, depending on, what part of White County you lived in. So, I think that the health impact is significant. And for those who, don't have a vehicle or perhaps don't have the time or the means to make a journey like that for any type of care, they're simply just going without that. And the long-term health effects of that are, they compound, and you can see how it impacts the lives of these people living in these areas and their families.
I was really shocked by one of the statistics in your story. The National Bureau of Economic Research found that rural hospital closures increased mortality for emergencies like heart attacks and strokes by about 10%. You talk about the compounding effect here, but a 10% greater chance of dying is pretty significant and pretty urgent as well.
It is. It is. It's an, and I I talk about rural hospital closures as in, there's a crisis in rural America, and those are the types of metrics that when I was doing this research, keep coming to mind. It really is. It's the difference between whether you survive or die. And for many conditions, if you were just a little bit closer to a hospital or had access to that care, these people would have very different health outcomes. So I think that going back to, my personal experience, I think whenever I look at these metrics or look at these statistics, the things that are sticking out to me, I'm putting people are coming to mind who I grew up with or who I knew and how this impacted them. And I think that it's not, of course, not just my story. That's a story for millions of people living across America, and the sort of calculations they're having to make every day about, do we dial 911? Do we try to get an ambulance? Do I just put my loved one in the car and drive as quickly as I can to the nearest hospital? And in rural America, these are calculations that people are making every single day.
The other thing that I noticed, and you didn't sort of lay this out explicitly, but you sort of established a very common pattern for these closures that often it's labor and delivery services that go first. You talked about how many of these providers then give up cardiac care. And then I think you cited a statistic that two-thirds of U.S. counties now don't have an oncologist. So they have sort of a pretty typical retreat from full-service care, right?
Yeah, and I think that there's a lot of different factors that go into those decisions, and of course, it's probably it's different for each facility. But I think for the labor and delivery services, specifically, that requires, of course, specialized clinicians, and also you have to have a surgeon who is available 24 hours a day. As we know, on top of the shaky financial footing that rural hospitals are on, there's also, and it's a completely another story that I could write, but just the shortage of clinicians and specialty clinicians, physicians in the United States, and also the huge job of trying to recruit them to a rural area that is quite challenging for many of these rural hospitals. So part of it is financial, and another part of it is just getting some of these physicians or specialized physicians to even go to a rural to relocate or move to a rural area to practice medicine there.
The really unique thing about your article is that you had a lot of research, not just on the health impacts, but the economic impacts of hospital closures. You compared it to the difficult economics of a corner store. Everybody wants the latest and greatest and convenience to boot, but these enterprises don't have the economies of scale to make it affordable. Talk to me about the indirect impacts when these places close, the ripples that go out from a hospital when it turns the lights out and locks its doors.
Yeah, and I was I had dug into this quite a bit for the story that I wrote, and so of course the immediate visible impact is employment. So when the hospital closes, you're going to lose 50, 70, 100 of the highest paying jobs in the county because the nurses, physicians, and others who work at the hospital. But that's really just the beginning. So some of that research that I cited in my story found that per capita income drops by about 4% overall. The unemployment rate increases by about 1.6 percentage points, and healthcare employment falls by around 14%. So it's the economic damage extends far beyond the hospital itself. So that local businesses lose about 2% of their jobs, which actually ends up accounting for about 40% of all job losses after a closure. So I guess to think about what that means, it's you lose the hospital, which eliminates those direct healthcare jobs, and then you lose, sort of the pharmacist. Then you lose the restaurant where the hospital workers used to eat lunch, or the gas station they used to go to fill up their cars on their lunch break, whatever it is. The economic disintegration it radiates outward. And so there's that, these closures accelerate actually the exact problems that made the hospital financially unviable in the first place. So young families are going to leave, the population is then aging, the tax base erodes, and you end up in this loop where the loss of the hospital makes the community less viable, which makes it harder to attract any kind of economic development. And then that makes the community even less viable. So I was very interested in this to be able to dig into it a little bit deeper, because as part of my reporting and those on my team, we of course cover healthcare layoffs across the healthcare industry and hospitals, but looking at the broader economic impact in these communities was really eye-opening for me.
I want to go back and refer to your conversation with the Oklahoma Hospital Association president. He referred to these communities where hospitals close as paper towns, kind of on the map, but not a town in the historical sense or what someone might expect. You talked about how some economic developers even specifically require a nearby hospital emergency department. School enrollments fall, and these towns struggle to remain living, vital institutions.
Yeah, and he provided such a good, it was such a great illustration when he said paper towns. They're still on the map, but hollow in reality. And that was so true because it happens little by little. And I saw it in my own hometown of Carmi. You start to see schools needing to consolidate because they don't have the number of students to support the number of schools that you had previously, or you start to see, different stores close or restaurants close, and then also just the fact that there's nothing new coming in, and people are leaving, and it becomes one of those. It's just a sad story of these people. They will find workarounds, and they try to make, things work as well as possible, but you just see over time how the resources are dwindling and the opportunities just aren't there anymore. And so yeah, he did a great job of providing sort of that illustration of what that looks like.
Well, I want to touch on another subject that you brought up in your article about Carmi, and that was the difficulty of getting the hospital reopened. I think that even when a hospital closes, most people are aware that it's a dire circumstance and they're going to try and reverse this if they can. Carmi tried to reverse it, but it turned out to be a very difficult process. There's a belief that a hospital can be reopened and reinvigorated, but it's easier said than done, right?
It is. And the story of what happened in Carmi, it really does echo the experience of so many other small towns where hospitals have closed. Many of them that I've written about over the years. But after the hospital, it was White County Medical Center, after it closed, there was this nonprofit organization that formed, and they had this. Their explicit intent was to sort of renovate and reopen the hospital with with emergency services, some ancillary care, long-term care. And then there were pledges made from people in the community, there were donations, and there was genuine hope. I remember the feeling, I remember hearing people talking about it, the donations that were being raised, that the hospital was going to reopen. And then, fast forward, that nonprofit foundation ended up hundreds of thousands of dollars in debt to the city. The city had to eventually forgive the debt. The donations evaporated. The story, it's its own, but it also echoes that of many other small towns and where hospitals have closed. And so the promise of reopening the hospital or having any services there at all never actually materialized. And I there's often this period where a community believes reopening is possible. Like I said, that happened in Carmi. Many of these other hospital closure stories I'd followed over time were the same. There were donation drives. There are staff still showing up, not even being paid, under the belief that things are going to turn around. And then when it doesn't, it's just it's tragic, but also just a sort of gets rid of all of the hope, I guess, that you see. It's like they finally are understanding that the building's just going to sit there empty, and that's what's happened in Carmi. It's just an old building with a rusted emergency sign in front of it, and kind of like a physical monument to what was lost.
So I'd like to go back a little bit and talk a little bit more about your own experience. Obviously, you grew up there. You have friends there. I don't know if you have family anymore there anymore in Carmi, but tell me a little bit about what happened in the 20 years since this happened. What you've seen happen with your friends and family in the area, and sort of the felt experience of this.
Yeah, I've had both friends and family who had to permanently leave Carmi because they weren't able to have access to the care that they needed. And I won't go too much into their health issues, but this was not highly specialized care. And then at the same time, there have been for those, I have many friends still in Karma who have stayed, and like I mentioned, whenever they, whenever someone is going to deliver a baby, or when they need that prenatal and postnatal care, it is very, you know, it's just accepted that you will drive those 50 plus miles to Evansville, Indiana. And that's what they do. I think the biggest issue that pops up is this emergency care issue, because there is a hospital that is about a 20-minute drive away from Carmi. And so if you call if you need a call 911 and get an ambulance, that is where they're going to take you. But most people know that that hospital is not equipped to handle certain types of emergencies or necessarily to provide the top tier care. And so many people, instead of trying to get an ambulance or dialing 911, they, as I mentioned in that example earlier, they will put their loved one in their car and they will drive as quickly as they can to Evansville, Indiana to get to the emergency room there. And I think that's something that, for me as a person who lives in a city now, I live in Chicago. I just can't comprehend having to make those types of choices with my friends or family in an emergency situation.
You also talked a little bit about the changing demographics of these towns. Have you seen that? Have younger people made other choices? Is the town aging? What does it look like?
Yeah, the town is aging. The people there are or there aren't young people moving there, and young people are moving away. I think that when you're looking across the board at the population there, it is. And I think in my story I described it as grain, but it is. It's leaning older. And of course, for those individuals, they then are having to make decisions about what access to care they have. But for young people, they're, young people are moving away and then they're not coming back because there's the access to medical care issue, but then also, as we talked about before, the economic piece of it as well. There are not jobs and opportunities, so
Yeah, and
there
I want
isn't
to
much reason.
make
Yeah.
that very clear. You don't attribute what happens to this town solely to
Oh,
the
sure.
closing of the White
Yep.
County Medical Center. There's a lot of other factors, and it's difficult to sort of tease out the impacts of one versus the other.
Yes, there is, and I think that, of course, the lack of a hospital and the closure of a hospital that goes into the economic development, piece of it in terms of you can't attract certain industries in, or people don't want to move there. Obviously, if you don't have access, if they need access to care or feel they need to be closer to it, but also yes, it's there as in all of rural America. There's many other factors that come into play as well, but yeah, lack of access to a hospital or medical care is definitely a big issue.
And you wrapped up your article talking about sort of the future here. Obviously, there's been some significant federal legislation this year, the One Big Beautiful Bill Act, and changes to Medicaid. And you sort of looked at that and talked a little bit about particularly the Rural Health Transformation Program. You, I'm sad to say, didn't offer a lot of optimism on whether the RHTP was going to address these issues going forward. Talk to me a little bit about the new challenges that rural providers are going to face and how much help they're going to get, do you think?
Yeah, so the the one big beautiful bill, of course, as signed this summer. So it's going to cut federal Medicaid spending by about $1 trillion over the next decade. So the Congressional Budget Office has estimated that that's going to be maybe around 11, 12 million people will lose health insurance coverage as a result. Some foundations have estimated that to be up to 15 million. So, I think when you're looking at the Medicaid cuts and how significant they are, knowing that rural hospitals, a large percentage of their revenue comes from Medicaid. So I think on average it's around 20%, but for some rural facilities it is up to 50% or more. So you're going to have more uninsured people walking through the doors of these rural hospitals that are already, many of them, on the verge of closure anyway. And the rural hospital transformation program and the funds that have been put there, it's, $50 billion, which is, I'm not saying isn't anything. That is, of course, quite a significant amount. But I think that when you look at the details of what those funds can be used for and how it will be distributed, which there are still some questions. We don't have all of the answers yet there, in terms of exactly how that's going to be distributed or how much each state will get. From those that I spoke to for this story, they don't see it as a solution to the problems that rural hospitals are facing.
And
Of
I think
course,
you
yeah,
outlined some pretty dire problems. You talked about rural hospitals potentially losing half of their net income in
yeah.
the coming years under these new Medicaid rules. That is a bitter pill to swallow.
Yeah, and these facilities are already operating on razor thin margins. So whenever, I thinking putting myself in the shoes of administrator of any of these rural hospitals, I don't know how you start to plan for the future and what that will look like. I think that it's going to end up with accelerated hospital closures.
I think it was a very apt description that you had at the end of your story. It's, the RHTP is a tourniquet in a country that keeps inventing new ways to open the wound. A sad observation there, I think.
It is, and my experience reporting on rural healthcare has been, I've been writing about issues in rural America and access to healthcare for I don't know, 12, 13 years now. And that's obviously not a substantial amount of time when you think about how long some of these issues have been going on. But I will say that the stories never change. There was a brief moment there during the pandemic when some of these rural hospitals got some financial reprieve from the funds that they were given. But outside of that, the stories always remain the same. There's been a lot of different challenges over the years, but it's always been we are on the brink of closure. Hospitals need support. And another thing that I point out in my story is this isn't an issue that's only affecting rural hospitals in the South or in the Midwest. Whether it's, there are rural hospitals in California, rural hospitals in New York and Maine that are being affected by the same issues that, hospitals in Texas are encountering. So it's an issue that, across America that we need to figure out a way to better support rural health care because it is something that's impacting all of us or someone we know.
Well, you've written a fantastic story here, and it's made even more poignant by the care you obviously still have for your hometown. Thanks so much for your research and your coverage of this issue, and thanks so much for your time today. Again, that's Ayla Ellison, Editor-in-Chief at Fierce Healthcare. You can find her story at hospitals.mn/Carmi. That's hospitals.mn/CARMI. I'm Tim Nelson, and you've been listening to Hospital Matters from the Minnesota Hospital Association. Join us next time for another look at issues impacting hospitals, health systems, and patient care in Minnesota. Thanks for listening.